Hi, and thank you for attending Resiliency Communication, part of the series of Resiliency in First Responders. I'm your instructor, Rick Campos. So, what are we going to be talking about today? Today, we're going to be talking about resiliency communications. Because of the proportionally higher number of critical events that first responders face compared to the general population, they are at a significantly higher risk for facing mental health crisis. This course will cover the following topics: how to recognize when someone's having a mental health crisis, how to talk to someone who is having a mental health crisis, how to assist someone who is having a mental health crisis. We're going to discuss the benefits of peer groups. And lastly, we're going to learn how to speak up if we're worried about a coworker's mental health. Now, what is a mental health crisis? Well, a mental health crisis is any situation where a person's behavior puts them at risk of hurting themselves or others and or prevents them from being able to care for themselves or function effectively in the community. Now, mental illnesses are medical conditions. They're medical conditions that disrupt a person's feelings, thoughts, mood, ability to relate to others, and daily functioning. Now, just so we're all clear, it does not develop as a result of poor character or low intelligence. Now, just like diabetes is a disorder of the pancreas, a mental illness is a disorder of the brain which can make it difficult to cope with the ordinary demands of life. Now, what are some of the symptoms of mental illness? Well, some of the symptoms of mental illness will vary. They'll vary from one person to another, and each person responds differently to the stressors of life. There also may be conditions present that further complicate the mental illness. Presence of other conditions are called co occurring, comorbid conditions, or a dual diagnosis. One of the most common of these is alcohol abuse. Now, mental illness does not always lead to a mental health crisis. Many things can lead to a mental health crisis, not just one thing. Many things can, such as occupational conditions and critical events that a first responder may experience over the course of their career. Now, these can have a cumulative effect that can lead to a mental health crisis. Studies show that first responders are at a greater risk of suicide and other mental health crises. Other stressors may play a significant role in developing mental health issues or lead to experiencing a mental health crisis. Some other situations that may contribute to a crisis may include losses of any kind, such as a death, estrangement, a relocation, relationship conflicts, trauma, lack of understanding from peers, coworkers, or supervisors, real or perceived discrimination, drug or alcohol abuse. And you could see that more frequently the abuse will happen. They'll take more than usual, or they're using the substances or drinking alone, stopping or starting a new medication, or even missing doses of medication. So, do you think there's one warning sign? No, there's multiple warning signs of a mental health crisis. And it is imperative to know what the warning signs are, but you must understand that these warning signs may not always be present and observable. People can hide things pretty well. So understand that they may not always be present or observable by others when a mental health crisis is developing. The presence of these symptoms is not evidence that a mental health is present or that a mental health crisis is impending, but it should be put on your radar. Many of these symptoms are typical reactions to an increase of stress, and many may be a result of symptom or another underlying medical condition. Because of this, new, effective psychiatric evaluations include a comprehensive physical assessment to rule out the possibility of underlying physical illness. Now, it is not uncommon for someone to experience a delayed reaction to a critical or traumatic event. It is also not uncommon for mental health issues in a first responder are from a cumulative effect of occupational conditions and critical events. because stresses that are experienced over a long period of time have a cumulative effect, and a person may seem to be doing surprisingly well as they face significant challenge. But it may take time for our bodies and minds to feel the full weight of the struggle we're dealing with. It's important to know and recognize the warning signs that an individual may be struggling with so that you could support them in the best way possible. Now, remember this acronym NAMI, the National Alliance on Mental Illness. According to NAMI, the most common warning signs fall into five categories, and we'll discuss them further. These five categories are social withdrawal, irregular expression of feelings, mood disturbances, changes in behavior, and thought disturbances. Now, right here, we have three windows here that express these, such as social withdrawal. We'll take a couple here. Sitting and doing nothing for long periods of time, dropping out of previously enjoyed activities, maybe declining work or athletic performance. Now, as we look at mood disturbances, we're looking at deep sadness unrelated to recent events or circumstances. Here's a key: depression lasting longer than 2 weeks. Someone who was once maybe optimistic now becomes pessimistic. They perceive the world as gray or lifeless. Here's a big one. Here's a big key: thinking or talking about suicide. Regular expressions of feelings: hostility from one who is usually pleasant and unfriendly, laughter at inappropriate times or for no apparent reason, or maybe just being indifferent to situations, even ones that are highly important. Look at changes in behavior. They can be hyperactive, inactive, or alternating between the two. Lack of personal hygiene. You can see the drug and alcohol abuse starting to rise or starts to become more prominent. Maybe bizarre behavior: skipping, staring, strange posturing, maybe grimacing. These are a couple of examples. Maybe even moving out of home just to go live on the street. Maybe not sleeping for several nights in a row. Now, as we look at thought disturbances, we look at the inability to concentrate, irrational statements, use of peculiar words or language structure. You can see them starting to display excessive fears, suspiciousness, paranoia. So, a mental health crisis should not be overlooked. And the reason is they can often involve the risk of suicide. Now, the risk of suicide is a major concern for anyone with mental health conditions, especially when we consider that first responders have a significantly higher suicide rate than the general population. Now, people who experience suicidal ideations or attempts usually feel a multitude of emotions. Some are right here: shame, guilt, rage, hopelessness, powerlessness, loneliness, overwhelming emotional pain, worthlessness, frustration, and even sometimes self hatred. Social isolation is also very common. Purposely isolating oneself reinforces the belief that no one cares if the person lives or dies. Most importantly, any talk of suicide in here, big capital letters, must always be taken seriously. This is especially true if someone has attempted suicide before. Studies have shown that previous attempts at suicide increase the risk. Now, according to NAMI, the following are warning signs of suicide. Okay, we're going to go through these. Taking steps to tie up loose ends, talking as if saying goodbye, making or changing a will, preoccupation with death, withdrawal from friends, family, and regular activities and interests, failed romantic relationships, dramatic changes in personality, mood, and or behavior, saying things like nothing matters anymore, this place will be better off without me, and life isn't worth living. Sudden cheerfulness or calm after being despondent. An increase in drug or alcohol use, giving away personal possessions, stockpiling pills, or obtaining a weapon. Now, this may not be evident for those who have already have access to this means of suicide. And right here, a history of suicide attempts, or family or friend that has a history of suicide attempts or has died by suicide. If you recognize any of these symptoms or warning signs in yourself or those around you, it is essential to act. If for yourself, you want to reach out to your support team, ask for help. If for others, be sure to act because ignoring these symptoms can have fatal consequences. Acting on our observations by reaching out to those who we see are having a mental health crisis is something that we are frequently told to do, yet there's no clear rubric or definition of what that means. The most important action you could take is to communicate with that person. If you recognize one or many of these warning signs that we discussed, don't be afraid to talk to them. Now, there are many things that you can do, and these can be discussed categorically. And we'll talk about them in the next few slides. Things such as take it seriously, don't be a hero, talk to the person you're worried about, expect some amount of shame, be mindful of your feelings, and discuss how you can help. And now you have to understand they may not want help. So what do you do if they don't? Let's see, let's take it seriously. A mental health crisis, expressed suicidal ideations or suicidal behaviors should always be taken seriously. Stay calm. Encourage the expression of feelings and be willing to listen without judgment or criticism. Now, here's the big key word listen. Now, a lot of us, when we start talking about our problems, take it seriously. A mental health crisis, expressed suicidal ideations or suicidal behaviors should always be taken seriously. Stay calm. Encourage the expression of feelings and be willing to listen without judgment or criticism. Big key word there is listen. A lot of times we like to give advice, and we're thinking about that advice to give while the person is talking to us. So, are we truly, really listening? In this situation, step out and just listen. Listen to them speak. Write down notes if you need to, but listen. Reassure the person that you are there to help and support them. Suicidal thoughts are temporary. And remember that depression and other mental health conditions are treatable. Don't be a hero. When there's a mental health crisis in others, the responsibility for their complete recovery is not a burden or expectation that you need to place upon yourself. Consider talking with someone who also knows the person very well. Talk to them about what concerns you have and what you have observed. Ask if they have noticed any changes in the person as well. Now, I can understand it can be difficult to know exactly how to respond to a declining mental health or mental health crisis in someone you care about. You also want to protect the person's privacy as much as you can, but safety should always take precedence over privacy. If they are going to harm themselves or others, we need to tell someone. And remember, this is not a burden that you need to carry alone. Talk. Just talk to the person you're worried about. But before approaching someone, there are many things that should be considered to ensure the best outcome possible. First, consider whether you are the right person to approach the individual, such as have you prepared yourself with knowledge and skills to approach this person? Do you have negative experiences, attitudes, or beliefs towards people with mental health problems? Do you think that you can offer empathy and compassion, regardless of your perception of the issue? And lastly, are you part of the workplace culture that is contributing to the solution of the problem? Some questions you need to ask yourself before you begin the conversation, because it is going to be a safe area and a judgment free zone. Now, before you go talk, have a plan. Have a plan for how you're going to approach that person. Make a plan for what you want to communicate. Be clear in your own mind about what specific behaviors you have noticed. Find out what resources are available in your department to support people with mental health issues. Be familiar with the organizational policies, procedures, and anti discrimination laws. Familiar yourself with NAMI guidelines on how to help someone who is suicidal. Pick a suitable time and place. The conversation should take place in a very neutral, private space. Should also be free of distractions and interruptions. Consider starting the conversation with casual conversation so the person doesn't feel ambushed. Lead into the conversation. Before we go and start the conversation, we want to make sure it's in a comfortable and non confrontational setting. Speak about concerns or specific signs that you've noticed. Or maybe over a cup of coffee. Here's some examples of ways to start the conversation. Hey, I noticed that lately you haven't been going out to games. You used to love to do this, and we had a lot of fun, man. Is everything all right? Or, hey, it seems like lately you're posting a lot of sad stuff online. I mean, you're listening to a lot of sad music. Man, are you okay? Is everything all right? The next question should establish if they are thinking about or planning for suicide. This could be along the lines of, "Hey, I'm worried about you. Are you thinking about suicide? Do you have a plan? Do you know how you would do it? When was the last time you thought about this?" By understanding if they are thinking about suicide, that'll give you a better game plan to get the support needed to help out. Now, as you ask these questions and the answers come back yes, or if we ourselves think that we are at risk for suicide, we need to seek help. And we need to seek help immediately. Call a healthcare professional, preferably their therapist or psychiatrist, physician, if they have one. Remove access to things like weapons, medications. Call the National Suicide Prevention Line at 1 800 273 8255. That's 1 800 273 TALK. And listen, offer support and assurance. Focus on being understanding, caring, and non judgmental. Understand that they feel alone. So emphasize that they are not alone, that we are there for them. Voice your concern with things such as, "I'm concerned about you, and I want you to know that there's help, and there's help that's available, and we're going to get you through this." Be sincere. Now, just as there are things to say, there are also things not to say, such as, do not promise secrecy. Instead, use phrases like, "I care about you," and "I care about you too much to keep this kind of a secret, and you need help, and I'm here to help make sure that you get it." Do not debate the value of living or argue that suicide is right or wrong. Do not try to single handedly resolve the situation. Never, and I mean never, say it's all in your head, just snap out of it, or make comments that are dismissive. And above all else, please remember a suicide threat or attempt is a medical emergency requiring professional help as soon as possible. Now, expect some amount of shame. Shame is often felt by a person experiencing declining mental health or a mental health crisis. Especially true when the person has been unable to meet their normal daily obligations and is already feeling some guilt over their decline. And by bringing attention to it, may amplify feelings of guilt or shame. It's important to express as clearly as you can that you can care about and support them regardless of struggles that are present. Express that there is help and there is hope. But also be mindful of your own feelings. You must be aware of your own feelings about the other person's well being. Understand that if things don't go well when you speak to them and they're not honest, or they're not telling you the truth, or they're denying it, or they're denying any type of support, we may become angry because of our concern for their well being. You need to recognize and address your own anxiety and emotions about the situation so that it can be managed more effectively. And now we get to the discussion about how we can help. Here's one of the most important things we can do is provide a listening ear. We can assist the person with a self-directed plan to address the crisis. Now, if this is appropriate, we can help them to seek out mental health professionals or treatment options. Again, if appropriate. We can assist in researching other resources that may be helpful. But we're going to support. We're going to support them through this. And by doing that, we can support them by taking them to appointments. Maybe we can help set up the first appointment with their permission. And then go with them to their appointments, again with their permission. Now what if they don't want help? Now what do we do if they don't want help? People experiencing declining mental health or mental health crisis may not want or be ready to research offered help. There's a few things that are very important to do. And remember, if someone you care about refuses help, we need to stay supportive. We want to ensure that the person understands that we care about them and we're there whether they seek help they think they need or not. Take the long road. Someone who is not willing to seek help now may be willing to seek help later. Now, this approach assumes that there is not an emergency or risk for imminent self harm or others. And take care of yourself. Now, it can be extremely difficult emotionally to see the decline of someone that we care about. So, seek extra support and guidance for yourself if someone you care about declines treatment. Now, there are many techniques that can be used in the event of a true crisis. Remember that your priority is to listen, to support and assist the person in getting help if needed. Now, you want to keep your voice calm, avoid overreacting, listen to the person, express support and concern, avoid continuous eye contact, ask how you can help, move slowly and be patient. Remember, you're on their time. Avoid touching the person unless you ask permission. Gently announce actions before initiating them. Give them space and don't make them feel like they're trapped. Don't make any judgment comments. Don't argue or try to reason with the person. Offer options instead of trying to take control. Now remember, if you are unable to de-escalate the crisis yourself, it is important to seek additional help from mental health professionals who can assess the situation and determine the level of crisis intervention required. It's important to remember that because not all symptoms of mental health are obvious. It's important to remember that because not all symptoms of mental health crisis are obvious to those around us, sometimes the person in the crisis will need to be the one to reach out. Now, here are a few ways to talk to someone if you find yourself in this situation. When you don't know what you need, some things you could say is, I'm depressed, anxious, or suicidal. I'm not sure what to ask for, but I don't want to be alone right now. Now, when we feel that we are the one in the mental health crisis, we should speak up. I equate it to grabbing someone by the collar, looking them in the eye, and saying, hey, I need help. Because sometimes that's the only way people are going to listen. So, by being clear and concise with how you're feeling and what you're going through, the person you're communicating with will have a better understanding and know that this isn't something to be taken lightly. Here's some other examples of how to talk to someone when you yourself are feeling you're having a mental crisis, such as when you need to feel connected with someone. Call someone up. Say, hey, can you check on me? Just to make sure I'm all right. Just keep on checking in with me. Or when you feel like a lot of self-hatred, right? Say things like, I've been feeling so low. Can you share a favorite memory of us to remind me what I meant to you? It would really help me out. You're communicating what you need. And again, if you find yourself with suicidal ideations or thoughts of suicide, reach out to mental health providers. Like right here, down here, it says, when you feel like you'll snap, a statement that'll really get people's attention is, I'm suicidal. I need help, and I need help right now. Now, just as if you were having a mental health crisis, you would want a few things, right? So it should be the same when we are dealing with friends or coworkers that are dealing with mental health crisis. When someone you know is experiencing a mental health crisis or showing signs of suicidal behavior, remember three important things. One, take it seriously. Two, ask questions. In the previous slides, we discussed some of the questions to ask. Get help. This isn't something that you may be able to handle on your own. Now, if you think a person is suicidal or you discover plans for self harm, it is imperative that you treat it as an emergency. If you suspect that a person is in danger of harming themselves or others, seek help immediately. Now, there are a few direct actions that we could take if there is a danger of immediate harm in the wake of a mental health crisis. One, take them to the ER. Medical staff can help you deal with the crisis and keep the person safe. They have rooms. Following an assessment by a clinical professional, the ER will determine the potential and see what kind of options are needed. If they're unable to take the person to the ER, contact a crisis line. But all in all, do not leave suicidal individuals alone until help is available. Crisis services are meant to stabilize those who are in a crisis, and it's designed to get immediate help they need in a safe setting. Not all mental health issues will include plans or a possibility of harming themselves or others. There are many other ways in which you can support and help those who are struggling, such as calling the person's doctor, psychiatrist, therapist, or other professional that they're already working with. Now, this is the preferred option when there is time to formulate a plan to support the person and they are not an immediate threat to themselves or others. Now, this is best when done with permission and it can be done without informed consent. If the person is not currently seeing a provider, help the person. Help them make the first appointment. Best when the situation is not urgent and the person is in the early stages of an impending crisis. Getting all that information can be a little overwhelming. So, by stepping in and helping them make the first appointment, kind of takes that pressure off of them. Call your local crisis service. These services offer intensive short term counseling to help stabilize and prevent crisis. But again, most importantly, do not leave suicidal individuals alone until help is available. Remember that there are many barriers to first responders receiving treatment for mental health issues. Being aware of the barriers that the individual could be facing is important in helping them overcome these barriers and move forward with necessary treatments. The Rudderman Family Foundation report classifies barriers to addressing mental health into three groups, such as cultural barriers, lack of awareness, and pragmatic barriers. You can see here off to the right of your screen, we have the different groups. So when we talk about cultural barriers, we're looking at strength, bravery, and resilience are revered, so they see it as weakness. We also see that in the cultural barriers, the responders fear speaking out and they feel that it will limit their career. Maybe lack of awareness, such as shame, fear, and embarrassment, the stigma of mental health. You have pragmatic barriers, such as the cost. Could the cost of this treatment be high? These are some of the barriers that we find ourselves in. Now, as we discuss a little bit about those cultural barriers, we discuss that the strength and bravery and resilience, how those are revered, especially as first responders, especially as the heroes. We don't want someone to look down on us, so we see it as weakness for mental health. And that prevents us from seeking the help that we need. As we discussed lack of awareness, Things like the media. The media doesn't report that the first responder suicides are high, and this creates the problem that there is no problem. And then we have the pragmatic barriers. We talked a little bit about the cost, but we also need to talk about the erratic work schedules. We're doing more with less. Now, what do we do after a crisis? Well, we got to understand that recovery will be a process that requires ongoing care, treatment, and support. Every plan for recovery will differ for each person. Being a support to another after a crisis will vary depending on the needs of that person. The most important thing is to make sure the person receiving support feels comfortable, that they feel comfortable reaching out to continue their recovery. We need to understand that setbacks and bumps in recovery is normal. We need to remain supportive after a crisis because it is essential to preventing another crisis. After a mental health crisis, mental health professionals should create a plan, like a treatment plan, and a safety plan with each patient. A safety plan is a tool that helps the patient to identify resources that can be used if the suicidal urge or mental health crisis occurs again. Now, we just talked about a safety plan. Well, what is it? And what's the importance of having one? Well, a safety plan is a tool that helps the patient to identify resources that can be used if the suicidal urge occurs again. Patients can list their coping strategies after each element. These elements of a safety plan can include the following: warning signs. Warning signs that a crisis may be developing. You have internal coping strategies. Things I can do to take my mind off of problems without contacting another person, such as relaxation techniques or a physical activity. People and social settings that provide distractions. Having people that they can ask for help. Utilizing professionals or agencies that they can contact during a crisis. This can include a therapist, an emergency contact, maybe a PAC team worker, and also how to make the environment safe. The importance of peer groups, group of friends. Now, any serious police movie or television program shows first responders knotted together around the bar in a close knit confraternity of the wounded, right? They talk out the stresses of the day. Now, it's in examples like this that the media gets it right. While not every first responder drinks, most will seek out others to blow off steam about the duties that bring them into the stressful events and emotions. Talking with friends works for most people, most of the time, but it may fail to provide an adequate safety net following critical incidents. Critical events lift stress far above normal background levels, and this stress could show up later in many different ways. Responders may grow irritable and have trouble concentrating. Their morale and productivity may suffer. Some may complain of physical ailments, while others may be tardy or call in sick more often. Some take leave of absence, and some may take early retirements, and others may take their troubles home, such as acting inappropriately or having family or relationship difficulties. Now, why peer groups are so important? Because they provide aid. They can provide aid to an officer, firefighter, EMT during times of professional and personal crisis. First responders are more likely to seek help through peers than someone outside the uniform. Peers have the power to help their fellow first responder connect to the people they feel are most likely to able to relate to them and help them. Peers should stay connected as long as they both find it beneficial. We're creating an environment, and that environment is built around prevention, intervention, and breaking the negative stigma commonly associated with discussing personal mental health topics. And this is an essential aspect of peer support in the first responder community. Peer support is an essential stress management strategy that should be focused on maintaining health and wellness in the first responder. The type of support provided by peers can range from one meeting, several meetings, or assistance in assessing clinical treatment. When is it appropriate to contact a peer? Sometimes difficult situations arise with a family member, such as a spouse or significant other, a child or aging parent. Sometimes the situation involves coworkers, a supervisor, subordinates, promotions, or even retirement. Sometimes it is an ongoing feeling of tiredness, feeling overwhelmed, or not being present in daily life, and or feeling isolated and alone. There are many times when it is appropriate to reach out, and they may differ from person to person. In the following page, we'll detail several times where it is appropriate to reach out to peers, either when you're experiencing these things or when you observe that they're experiencing these things, such as depression, stress, anxiety, other mental health issues. Like reaching out at the beginning of experiencing symptoms may prevent a mental health crisis. First responders may suffer from cumulative stress or have a stress reaction to a specific incident. Mental and psychological changes may result from these stresses. They can have legal and financial problems. If these problems are left unresolved, they can lead to tension and irritability in your personal and professional life. It could be family issues, such as relationships. Now, relationships can suffer as a result of first responder work. Job related stress. Job related stress from a supervisor, a subordinate, or a promotion, even retirement. Now, these are all able to create stress. To help that, we can bounce ideas off of a peer, and that can help us navigate our work environment. Critical Incident Stress Management Team, or CISM. Critical Incident Stress Management Team, or CISM. Now, first responders may be the first to resist all that touchy feely stuff that may come to mind when thinking of a peer support group, but they are embracing the critical incident stress management. And what this is, it's a peer led program designed for our world. If your department utilizes CISM, trained peer support team members should reach out to you after a critical event. Depending on your department, connections may also happen through a supervisor, or if someone reaches out for support on their own. The research on the efficacy of CISD is very positive. If two conditions are present, the conditions are personnel have been properly trained in CISM and providers are adhering to well published and internationally accepted standards of the CISM practice. How do we speak up? How do we speak up if we're worried about a coworker's mental health? In a profession that prioritizes bravery, toughness, and putting others first, there is a perception in many departments that speaking out about mental health struggles is contrary to the job. There are legitimate fears, especially as a police officer. They may feel that by speaking out about anxiety or depression, it may cause them to lose their weapon or be told they have to retire. This is entirely untrue. With or without this fear, safety should take priority. Employees that have a pattern of inconsistent or declining job performance, interpersonal difficulties, or uncharacteristic behavior are exhibiting signs and symptoms that may be struggling with mental health issues. It is likely that if you notice these changes in a coworker, that your supervisor has noticed these changes as well. Managers and supervisors are well positioned to not only recognize problematic behaviors, but also to take action early. Early intervention is a key step to increasing recovery rates. Whenever possible, privacy and confidentiality should be respected. However, if a person is at risk for harming themselves or others, you should not hesitate to speak up to a supervisor. When making a report, you should keep the following in mind. Make a plan. Make a plan for what you want to communicate. And be clear. Be clear in your own mind about what specific behaviors you've noticed. So be as factual as possible. Do you have any negative experiences, attitudes, or beliefs towards people with mental health problems? Now, if you do, be sure to keep your own opinions and feelings in check. Keep them to yourself. Now, we were told how to start the conversation. Now, as we discussed about starting the conversation with a friend or coworker, let's discuss how we start the conversation with a supervisor. Now, your relationship with your supervisor will determine the best way for both of you to have this discussion. If the culture of your organization is a formal one, or if your relationship with your supervisor is not casual, it may be helpful for you to request a one on one by email, text, as this can allow you to think and schedule time with privacy. If the culture of your organization is less formal, or if a relationship with your supervisor is less formal. It may be helpful to go out for coffee or a chat. Phrases like the following are good starters for this. Hey, I really need to get something off my chest. I need to talk. Do you think you have a couple minutes to listen? Be honest and direct about your concerns in either instance. In conclusion, as you can see here, the numbers communicate the health risks associated with being a first responder, such as the life expectancy of a first responder is 20 years less than average. Heart attacks are the number one killer of firefighters. Chronic stress elevates cortisol levels and leads to an increased risk of heart disease. 20 to 25% of all first responders experience PTSD. And the impact of our job affects our entire family. The purpose of this course was to educate you further on the statistics of mortality for first responders, particularly in suicide. Further, this course attempted to instruct you in actions that you can take when either you, as a first responder, or your colleagues have experienced significant mental trauma through critical events. During this course, you have learned how to recognize when someone is having a mental health crisis, how to talk to someone who is having a mental health crisis, how to assist someone who is having a mental health crisis, the benefits of peer groups, and how to speak up if you're worried about colleagues' mental health. By following the principles taught in this course, you will now be able to navigate the above conditions and ultimately provide a higher level of care for yourself, your colleagues, and ultimately your patients. I want to thank you all for tuning in and have a great day. And remember, you are your best advocate. Take care, everyone.